drive to have a drink. Okay? And so after you have a drink, what does the pleasure center say? It says, boy, that was good. Have another. So the point is that there's a conflict almost between the cognitive part, our higher cortical thinking part of our brain, and our impulses. Okay? They're sort of out of sync. They're in conflict. One's telling you one thing, one's telling you another. Let me give you another example of that. So here I'm talking to you all, and I'm giving my little speech tonight, and my mouth might be getting dry, and maybe when this is over, I'm going to walk out the door talking to one of you, and I walk over to the water fountain, bend down and have a drink, and I'll stand up erect, and I might say, boy, I was thirsty. Right? Point is that it was really my midbrain that took me over to that water fountain. It wasn't really a conscious process. It wasn't until after I had a sip of water I said, I was really thirsty. We've all had that experience. But that's how there is a separation sometimes between our drives and the cognitive part of our brain. So, as I mentioned, the hypothalamic drives, and I'm suggesting, in addition to the normal drives, I'm suggesting if you have an addiction, your body develops a sixth basic drive, primitive drive. And these drives are important. Obviously, if we didn't have a drive for sex, we wouldn't procreate and go on as a species. If we didn't have a thirst drive, we would die from dehydration. So these are important drives. You may have heard the concept that people say drugs. I don't know if any of you heard that concept that your brain gets hijacked by drugs. So that concept is usually in reference to cocaine, because when you're using cocaine, people aren't even hungry. They're not even thirsty when they're using cocaine. They can go days without eating and drinking because they're using cocaine. It hijacks even the primitive part of the brain. So this is a neuroimaging slide of the brain. Okay, and this is sort of what I was talking about, that amygdala lighting up part. Okay, so this here is this cross section of the brain is a person that they're showing like an addict, a cocaine addict, that they're showing a nature video to. Okay, for example, like Discovery Channel or something, the lions running through the safari or something. And you can see here's their amygdala. And here they're showing that same person who's a cocaine addict a picture of someone snorting cocaine. And you can see the amygdala just sort of lights up. Okay? There's memories there. So addiction really is about communication in the brain between nerve cells. It's really about one nerve cell in the brain communicating with another. So here is the end of one nerve cell communicating with the other. These are receptors and neurochemicals get transferred over. This is my slide that it's a Campbell slide that I modified to show the same thing. So when you're using drugs or alcohol, here's these neurochemicals, which are the messengers, sending the message from this cell down to this cell. And then this cell sends it on down to the next one. So it's really communication. And when you're using drugs or alcohol, instead of the normal amount of these messengers or neurochemicals being released to send the message into the synaptic cleft here, instead of a normal amount of neurochemicals being released, when you're using drugs or alcohol, you get a tremendous release. Okay? So, and they're picked up by the receptors over here. So what happens, what this is like is, instead of one cell talking to another cell, or one cell whispering at another cell, it's yelling at it. It's like this cell is now yelling at this cell. Well, the cell doesn't like being yelled at over here. So what does it do? It adapts. It gets rid of some of these receptors, so it has a way of modifying. So it's almost like the body likes things in balance. It likes homeostasis. So what it does, it's almost like it reaches over, it turns down the volume on the radio because it doesn't want to be yelled at. Okay? We call that adaptation.
Can I ask a question?
Sure.
If you're saying it's genetic, is that cell is it something like it's just got to be awakened? Are there like cells that are just in the brain and waiting to be activated?
What I'm talking about in the slide would happen to somebody who wasn't an addict too, who used, let's say, alcohol or cocaine. But what happens is the response that, any one person could do that, but that doesn't mean using one time that they're going to become an addict. Okay? In other words, if you drink, you're going to have a release of neurochemicals into your synaptic cleft that's abnormal, but your body will react to that differently. It'll settle back down and it won't become, you won't continue to use, whereas an addict will continue to do it over and over and over again. But what happens in the synaptic cleft with the release of the neurochemicals is the same. Okay? One is a genetic thing, this is sort of a neurochemical thing. I don't know if that can answer your question.
I was just wondering how you say it was genetic.
How you can say what?
The reaction was genetic.
Well, again, the reaction, the release of the neurochemicals like that would happen for anybody that used alcohol or drugs. But the response down the line might be different. How your body responds to the response would be different if you're an addict than an alcoholic. Okay.
Okay.
This is a good question, though. I guess we may have to come up with a better answer for that. I don't quite think that one through. But this is another example of that. This is this slide I call is what I call the anatomy of a snort. Okay, and this is normal dopamine levels in the pleasure centers of our brain. And this is somebody who decides to take a snort of cocaine. So they snort some cocaine, they go, ah, man, that was great. Okay, that feels really good. That's the release of all those neurochemicals. Okay, and so over a period of 5-10 minutes, what happens? The neurochemicals start to dissipate. And of course, does it stop at baseline? Well, no, not really, because you've depleted a lot. Your body isn't really made to release that much neurochemical. So you're actually depleted. Now, of course, no good addict really does that. They snort and they stay up here for a day or 6 hours or something. But when they finally stop using, their neurochemicals are depleted. And during this time, well, how long does it take for your body, for your neurochemicals to get back to normal? Days, hours, weeks, months, it depends on your age, what you've been using, how long you've been using. But during that time, your neurochemicals are depleted. During that time, people have symptoms, and AA will call that being restless, irritable, and discontent. We call that post-acute withdrawal. People have problems with concentration, memory, mood swings, irritability, restlessness. Those are all symptoms that can occur while your neurochemicals are depleted. Now, God, in His infinite wisdom, made us with the ability to replete those, but it takes time. Okay, and during that time, people have post-acute withdrawal symptoms.
Is that pattern common to, again, not just cocaine, but other?
With everything, all the substances of abuse, and that's why I put this example here, which is really the same exact concept, but this is an alcohol slide to talk about the same thing, a little different way, but the exact same. And I think this will answer your question. So here is alcohol. In our brains, we have inhibitory and excitatory neurochemicals. Our brain is in balance. We have excitatory and inhibitory neurochemicals. One starts to drink heavily, and alcohol is actually a depressant. It causes your brain to get depressed. Okay, the neurochemicals will be depressed. And so what does our body do, as I talked about? It adapts. How does it adapt? It starts putting out more of the excitatory chemicals to sort of bring things back into balance, because it doesn't like things out of balance. So now your body has adjusted, and here you are. We call this tolerance. You can go ahead and drink, and people drink for the next 15, 20 years, and their body's pretty much in balance, with their brain putting out a lot more excitatory neurochemicals to balance off that alcohol depressant. And then one day, you end up at Ridgeview, or you end up in jail, and your alcohol is gone. Okay? And what happens? All of a sudden, that alcohol is no longer being balanced. I'm sorry, the excitatory part of your brain is still humming away because it's been doing it for 20 years. The alcohol is gone,